This is a knowledge series on the dying and the dead. In glaucoma, the retinal ganglion cells are under stress and also some cells are dead. The dying cells or the stress cells can be picked up by electroretinogram by means of pattern ERG and by PHNR. The dead cells have been picked up by the OCT. There are various newer concepts in the OCT in glaucoma, especially on the optic nerve head. There are two main areas which we are really interested in. One is the border tissue of Elsnick and the other area is the Brooks membrane opening. So what the clinician perceives as the disc margin in the clinical examination or with the photographs is frequently a not true anatomic border of the neuroretinal rim due to the regionally variable and invisible extensions of the Brooks membrane that have not been previously appreciated. You will also appreciate that. So what is the actual margin or what is the true disc margin or the boundary? When you do the clinical examination, we really look at the inner edge of the scleral ring, otherwise called as the Elsnick ring in ophthalmoscopy or in the fundus photography. So that is basically the sclera, the inner tissue of the scleral ring, edge of the scleral ring. The next one is in OCT, we look at the Brooks membrane opening as the disc margin. Here it is shown in the red line. But in normal eyes, we may see both are coinciding with each other. But whenever you have the disc is little different, especially in myopics, you can see in this the sclera and the BMO are clearly very well defined by green and the red dotted lines. The green is the clinical examination and the red is the Brooks membrane opening. You can see how different both are. So which is the true boundary of the disc margin? Since the blood vessels and the axons cannot pass through the Brooks membrane, it is the true structural boundary of the optic disc. In histology, how the Brooks membrane will appear, and in OCT, how it is appearing. Actual thickness of the Brooks membrane is 2.2 to 5 microns. The thickness of the RPE is around 14 microns. But if you really see the thickness of the Brooks membrane will appear to be very thick in the OCT. That is basically due to the high reflectance of the Brooks membrane. Brooks membrane has 5 layers. Because of its high reflectivity, the Brooks membrane will appear to be much more thicker. So how do you really identify the Brooks membrane? You can detect the Brooks membrane by looking at the wedge-shaped ending of the choroid. Hope this information is useful for you. Thank you so much.